This is Democracy Now!, democracynow.org, The War and Peace Report. I'm Amy Goodman with Aaron Mate. Our guest is Dr. Paul Farmer. He's been working in Haiti and around the world for decades. 25 years ago, Dr. Farmer helped found the charity Partners in Health, which provides care to those living in poverty in central Haiti, as well as other places around the world. And he's written a new book called To Repair the World. Paul Farmer Speaks to the Next Generation. Dr. Paul Farmer is the Department Chair of Global Health and Social Medicine at Harvard Medical School and Chief of the Division of Global Health Equity at Brigham and Women's Hospital, where many of the victims of the Boston Marathon bombings were brought. Can you talk about the significance of that? And then we'll talk about Haiti.
Well, I think, in my view, they're related topics, and not just because I work at both the Brigham and in Haiti. First of all, there's a reason that everyone who made it to a hospital, like the Brigham, survived. You have, in a place like that, an incredible set of options to help people who are seriously injured or seriously ill. You have redundant systems in the sense that if you have, as happens with an earthquake or a bombing, everybody shows up at once. You need redundant systems, meaning you need backup teams and backup teams. So you can't have, like we have all over the third world, of power suddenly goes out. You know, the generator dies. You know, that's never going to happen at a place like the Brigham. There is so much capacity there that it's no wonder, in my experience, it's no wonder that people did really well, the patients did really well once they got there. And it's a reminder, you know, every time something like this happens in our country, in our affluent country, we get a chance to think how much humans need safety nets, you know, and that's what we're trying to build in Rwanda and Haiti. And if you don't have, you know, if you have only a community health system and no hospitals and someone's injured, then the person who's injured is out of luck. Or there could be a minor injury, you know, a minor injury that could be fatal because there's no hospital. If you only have the hospitals and no community-based care, you don't do well with chronic disease management. And so what we've been trying to do in Haiti, Partners in Health and the Ministry of Health and many partners, has been to rebuild some of the destroyed capacity for hospital care and teaching in the rural area, decentralizing from Port-au-Prince and the quake zone, and we've done that.
Can you compare Haiti to Rwanda? I mean, is it safe to say that your group is an exception to the rule in Haiti, in which, in your case, you work with community groups, money actually goes to Haitians, but overall, so much aid goes into the hands of foreign workers and foreign NGOs? Well,
we may be not unique, but we're trying to be different in two ways. Yes, that the money goes to Haitians, meaning Haitian employees, but we're also working to support the Haitian public authorities. You can't have public health without working with the public sector. You can't have public education without working with the public sector in education. So the privatization that we talk about in our writings or in shows like this, it happens insidiously too, when NGOs work with contractors, as you suggest, only, but also when they don't work with the government, the public sector. And that happens even more insidiously because people think, well, I work with a community organization or community groups, that should do it. Well, really? Not to build a safety network or social protection. It really requires working with both sides. So yeah, we're trying to make ourselves work that way, to build local capacity, even if we're doing something grand like building a teaching hospital. And that teaching hospital, if I could just mention one example that isn't straightforward, we did not have in Haiti the skill to build a lot of the guts of the hospital, you know, how you'd have wall gas in the walls, or the finishing work. And if you want a table to look like this one, you know, or the machinery that you guys contraptions you're using here, that production capacity doesn't occur in Haiti. We went back to the unions, for example, the electrical workers, the painters, the carpenters in the United States, and they came down and helped build the hospital as volunteers, but they helped transfer skills to Haitian craftsmen and craftswomen too. So it really was a teaching hospital before we ever saw the first patient.
I wanted to ask you about the cholera outbreak that erupted in Haiti in October 2010. It killed about 8,000 people, sickened about 620,000 people. Most independent studies say the outbreak originated with a battalion of Nepalese troops who were part of the UN peacekeeping mission after Haiti's devastating 2010 earthquake. But the United Nations has never formally acknowledged responsibility or apologized. Attorneys for thousands of Haitian cholera victims announced a lawsuit against the UN in 2011, and earlier this year, the United Nations finally responded by announcing its refusal to pay compensation. A UN spokesperson cited immunity under the UN's own rules.
In November 2011, a claim for compensation was brought against the United Nations on behalf of victims of the cholera outbreak in Haiti. Today, the United Nations advised the claimant's representatives that the claims are not receivable pursuant to Section 29 of the Convention on the Privileges and Immunities of the United Nations. The Secretary-General again expresses his profound sympathy for the terrible suffering caused by the cholera epidemic and calls on partners in Haiti and the international community to work together to ensure better health and a better future for the people of Haiti.
The UN spokesperson, Dr. Paul Farmer, your response?
Well, I mean, my response is probably going to be as a physician and an anthropologist, as we did immediately after the earthquake, as my colleagues and I did, saying what are the complementary steps that we could take to slow cholera and then eradicate it, and how are we going to save lives in a setting with this kind of water insecurity. And they're important. It is important to understand that we haven't really succeeded in achieving even those complementary steps in the public health and medical arena, to say nothing of the water and sanitation arena, which is going to require building massive municipal water capacity across that country like we have in this one, and like the Rwandans are trying to do in theirs. Those projects are also part of reparations. When I talk to patients, I kind of think of everybody as a patient or potential patient, so watch out. But when I talk to patients who are living in poverty, they really do talk about reparations. We need housing, we need health care, we need water, we want our kids in school. And, I think that among the various interventions we can make, we've got to remember that, those pragmatic
steps. Should the UN be
steps.
responsible for that?
I think the UN is responsible. I think the world is responsible. I think that everybody who in the past tried to move Haiti out of the fraternity of nations during the 19th century and failed to recognize its legitimacy as a nation. I think the French, who extorted money from Haiti, are responsible. I think I could go right through the list, And I do believe, as you've read in this book and others, that I believe in that kind of assessment of responsibility. The question is, again, what are the mechanisms by which we may offer reparations? And some of them have to involve transfer of resources to do those tasks that have not yet been done. And in doing that, obviously we further the goals of public health and medicine in Haiti, but also education, building businesses, etc. You can't, really hope to have local investment from local, I was going to say business, but as you know, I mean micro enterprise, etc., if people are sick. And if people are always living in fear of the next epidemic and want. And so I think we're all responsible. Anyway, I hope to be involved in this long term.
Well, on this issue, the priorities of the UN in Haiti spending hundreds of millions of dollars a year on a foreign military occupation. Is it time for that foreign occupation? And given that there's no war there hasn't been for a century.
I'll say again, as I did on the show last time, that that's not the approach to human security that I would adopt were I the architect. I would not have a militarized approach, but rather investments in basic social and economic rights for poor people, including the right to health care, the right to education. Those investments have not yet occurred in Haiti. Haiti will need rule of law and a police force just like any other nation, but we need to shift the focus towards building up capacity in these arenas. And that's what we believed when there was a Haitian army as well that had no and was founded during the U.S. occupation and never had a non-Haitian enemy. So it's still true.
We're going to leave it there. Paul Farmer, the author of To Repair the World. Paul Farmer speaks to the next generation. Our website is